Hello and welcome to Conversation Week. We're really excited to be with you. My name's Becky Elwell. I'm the Lymphoedema Advanced Nurse Practitioner at the Royal Stoke University Hospital and a proud trustee of the British Lymphology Society. And I will allow my colleagues to introduce themselves before we continue. Margaret?
Hi, I'm Margaret Seddon. I'm chair of the British Lymphology Society, and it's really great to be joining you as part of this initiative.
And my name's Natalie Phillips. I'm an independent lymphoedema nurse specialist as well as clinical manager at Hardening Healthcare and many other hats.
Thank you so much, guys. So with this focus on the lower limb, what we thought we'd talk about today was exercise and the benefits of movement. And I'm going to set the scene, first of all, by telling you a little bit about lymphedema. So lymphedema or chronic edema is failure of the lymphatic system. Your lymphatic system has three main functions. It transports fats from the gut. It's a transport system around the body, and it helps to mobilize antibodies to fight infection. So it's our defense against bugs and bacteria. And when we have failure of the lymphatic system, we can develop swelling and skin and tissue changes as well. And this can lead to debilitating and disabling conditions, which mean that it's very difficult to find shoes and clothes to fit. It affects body image, it affects quality of life and mobility. We know that movement is a key part of the lower limbs health and our healthy legs, so we all should be getting more active. But why? And I'm going to hand over to Natalie to find out a little bit more.
There's several reasons. It's becoming well documented the importance of exercise for total body health, really. But when we look at it in terms of management of the lower limb, it has several functions, really, in terms of promoting venous return in the legs, so if maintaining vein health. We know that due to the lower pressure in the veins, that to support those valves to return blood to the heart, it very much functions as part of the muscle pump within the legs and feet. So getting those muscles moving, even the slightest movement, can help with the veins, which is great when we're looking at chronic venous problems, because those venous problems and varicose veins means that the valves aren't working properly. We get increased fluid leakage back out into the tissues, which ultimately overwhelms the lymphatics. Exercise supports the lymphatics as well in conjunction with the veins, because the lymphatic system is a passive system. If we're not moving, that system isn't doing much to transport the waste products from the tissues back into the circulatory system. And exercise changes tissue pressure, which ultimately helps the lymphatics flow as well. So that's it in a nutshell, really, as well as sort of all the other benefits of exercise in terms of mental health and keeping us mobile and moving. It's that age-old adage of, if you don't use it, you lose it. So yes, yeah.
Thanks, Nat. That's great. And Margaret, can you tell us a little bit about why exercise and movement is key and central for the BLS?
Yeah, well, I think there are several aspects of treatment for lymphedema, and exercise and movement is one of them. And it's the one part that the patient can control. It's within their power to do, and it will make a huge difference to anything your nurse or therapist does to help that. And without it, it makes things much more difficult. So it's really important. But exercise it's almost a nasty word. I mean, we all know it's good for us, and we all hear that word and don't want to do it. And but it is really important for general health, as Nat says, but also specifically as part of the treatment of lymphedema. Do you want me to say any more about BLS campaign just now, or will you want to come back to that?
No, please carry on.
it. The Everybody Can campaign that we started was partly to reassure people that exercise wasn't only safe, but really good for you if you had anything wrong with your lymphatic drainage. But it was also to try and say that it didn't matter how limited you were, that you could do something. We do fully understand that if you have one or more big swollen legs, maybe due to lymphedema, there may be also other health problems alongside that that can make it really difficult to move your legs. It's hard, they're big, they're heavy, they're uncomfortable, and we know that movement is limited. So we're not suggesting that people turn up to the gym, or you can if you want to, and involve in workouts, but there are much more simple things that you can do. And the Everybody Can campaign was really to highlight that doing a little was better than doing nothing, and even simple movements show that how simple you can start and do 1 or 2 repetitions and then build that up. But the thing is, you've got to start somewhere.
I think what's really good about that campaign as well is it is saying to people that, and showing people that even just that getting up from the chair to go and make a cuppa, it is just it's enough as a start to try building that up, rather than just staying sat.
And so sometimes families think they're doing the kind thing in giving somebody the remote control, their snacks, their drinks, and everything beside them, and so they don't have to get up. But in actual fact, it's really important that they get up and do things regularly throughout the day.
Absolutely.
Thank you so much. I think that's really helped us to understand why exercise is important, the impact that it has under the surface of the skin. We don't necessarily see that. We don't think about that. We think about the muscles, but not any impact that it can have on the veins and the lymphatics. I really like the idea of use it or lose it. That's fantastic. I think tiny small changes, the Everybody Can campaign is saying start small and then build up from there. It sounds as though nothing is prohibited, but certainly start off by doing some small change, making small changes that can make a real difference. And I think the other thing to remember is where there is a lack of movement, that actually positioning is really important, so that gravity can play a part of drawing more fluid into the extremities, into the lower limbs if they are dependent. So elevating where possible and making sure that you sleep in bed at night, or the patients that you're caring for sleep in bed at night, to allow the legs to drain. I've thoroughly enjoyed our conversation this morning. Thank you so much. I hope the information has been of benefit. Please do visit the BLS website for more information. Please do visit the Leg Club website for more information. And Margaret and Natalie, thank you both very much. Is there anything else you want to add?
Not from me, no. Thank you.
Thank you so much.
Thank you.
Take care. Bye.
Bye.
Bye.